First and foremost, I would tell them that 30 days of a rehab program is not going to fix anything. Perhaps what it might be able to do is isolate you for a short period of time to decrease the probability that you might use for 30 days. But given the definition of an addiction as a chronic relapsing disease in which the structure and function of the brain have changed, and this also depends on the age of onset, when you used, what you were using, how long you used it, neurological changes aren't going to occur in 30 days. For the most part, people need to understand that the model that we're currently using does not have effective outcomes, and that is initiation of a 30-day treatment program followed up by maybe a short period of time of sobriety back in the real world and then going back to rehab again. Our average length of or number of rehabs for patients at ATS for people who are here is already 4. Most of our patients have been to 4 rehabs before they get here. Then what they find out is that as a result of teaching them to think differently, teaching them to have some impulsive control, oftentimes the average length of time that people are in an ATS program is about 24 months. At that time, they're able to have a lot more positive control. They're understanding coping mechanisms. They understand what stressors are for them. They're able to make healthier decisions, and they're least likely to go back to a pattern of using something that's going to hurt them. But even after 24 months, it takes some extended period of time where people practice behaviors. So it's really important to change your behavior, change your understanding, and understand that for the most part, addiction is an impulse control disorder that's precipitated by stress. So if we teach people to think differently about how they can handle stress and teach them coping strategies, it decreases the probability that they will rely on a substance to handle a new stressor in their lives.